Hello, RN-BSN students. We are so happy to have you at Appalachian State and part of our program. This short video has been set up to provide you some guidance on how you can get started with meeting several of our program requirements or at least begin to gather data and different things that you will need to become compliant with our program over the next few months. So what is required in the program? Every student will be required to have an American Databank Complio account. More details will be coming to you on how to set this up shortly. In the beginning of fall of 2022, you will be given access to an As You Learn project site that is specific for your RN to BSN class of 2022. And at that time, you will have all the details and all the instruction that you possibly need to set up this compliance account in Complio and complete education requirements, as well as complete your background check, your drug screen, and upload all of your immunization records, and then complete a variety of Department of Nursing forms. However, there's some things that we want to make you aware of in advance before this becomes available, because several things you can be working on in the interim from now until the beginning of fall semester. This will just help with your time management as you begin the RN to BSN program. And as many of you are working persons as it is, anything you can get done ahead of time is always advantageous. So when are all of our requirements needed? Generally speaking, November 1st is our deadline date for everything being completed. You may ask, well, what if I don't get everything done by, November 1st? The sad thing is, with all of our programs, if you don't meet a lot of the compliance deadlines or requirements, you can actually be put on probation in our program. So at all costs, we want to avoid that. Thus, getting you some idea of some things and heads up that you can be doing now to kind of ensure compliance is better. So prior to fall of 2021, getting prepared, what kinds of things can help you get there? We're going to provide you in the Google site a checklist of items, kind of a cheat sheet of things that you can begin working on and gathering while you're waiting to have access to the project site for your cohort. You may need to have certain immunizations done or boosters. You may need to work on things related to your licensure being renewed, or you may have needs to get something done in terms of BLS training. So you can validate and go ahead and pull, a verification of your RN licensure and print that out and save that into a PDF. So that's ready to upload when you get access to the Complio account. You also can validate when is my BLS coming up for renewal? Is it going to come up for renewal soon before this happens? Is it going to be good throughout the whole program? What if I don't have American Heart Association BLS? And you need to have that for our program. So can I easily get that somewhere between now and then? I would recommend that if you work for an employer that does not require American Heart Association and you're being mandated to get American Red Cross, feel free to email Dr. Becky Turpin, and you can find my information at the end of this PowerPoint to follow up with me. But rarely they will occasionally make an exception related to that, so I just need to get your information so I can request that. But for those of you that have your American Heart Association BLS, where is your e-card? Can you get it? Did you save it as a PDF already? Some people might still be getting physical cards at the end of BLS courses. If that's the case, those are the kind of things you need to have scanned into a PDF that can be uploaded. So just kind of getting some of the paperwork kind of organized and saved in files so that you can find everything and have it ready to get uploaded. And we'll talk a little bit more in detail and show you some examples of immunizations, because that's one that usually people are spending a lot of time over prior to fall getting pulled together. So here's just some other things. In fall of 2021, I mentioned you're going to have access to this project site. In the project site, once Ms. Coleman gets you access, you'll get instructions on how you're going to log into this site. But it's really like our site for communicating with you throughout the program. So you'll end up going in there quite a bit for different things in the future. But in it, there is a link to the website for how you go set up your Complio account. Do not go to the Complio. Don't look it up and Google it. Don't find it. It's not going to help you to go try to log into Complio now to get an account, because our login for that is unique to Appalachian State Nursing. So you cannot really do anything with this until you have the proper link and the instructions. And we don't want anybody to incur the cost of an account until you're really in our program and you've really begun our program. So that's another reason to, safeguard you that, and not only do it once fall semester begins. Also in this project site, you're going to have a core orientation training link that gives you a completion certificate that will need to be uploaded. We also have training materials in there for HIPAA and bloodborne pathogens that is mandatory, and some post quizzes that have to be completed. And then the scores of those will have to be uploaded into the Complio system as well. So just to know the cost, so you can kind of get prepared in terms of paying for this account, the Complio system is not free. Once you go in to set up your account, you're going to be ordering like a package that will be good for the whole year, and it includes the cost of a background check, a 12-panel drug screen, and the tracker that you'll use to upload all your forms and records and things. And it's a one-time fee of $125. So I want you to be aware of that. So, many of us are on budgets and we like to know what kind of costs to anticipate. So be realizing that towards the end of August, you're going to have to put aside monies or have it available so that you can order this and pay for this. And then we'll talk a little bit about the different components in this as well. I'll say this now, and there's another thing at the end of this that reiterates this, but every form that you're going to upload into the Complio system has to have your full student name. And if you think about that, immunization records maybe that you have from before you married or remarried or divorced may not be the same name that you're going into school with. So you may have to physically write in the right top corner your full student name. All of you, when you are accepted into our program, and you will be given a banner ID, and that is Appalachian State's student identification number. It starts with a 900 number. And every form that is uploaded to Complio has to have that 900 ... number, the banner ID number. That helps them validate that this person with this name is a student at App State with this ID number. So some people will kind of do in their PDFs, they like to just do it all electronically. So they will edit their PDF and they will just insert a text box and put this information in it and save it into the PDF. Other people don't deal all that well with that, and so it's perfectly fine for you to print your forms out, um, handwrite your full name at the top, handwrite your full banner ID, and then scan that back as a PDF to be able to upload it. So whatever method works for you is fine, but those are definitely requirements. A few other things that are required for them to accept documents is that if a medical provider has signed something and it requires a physician's signature on the form, it has to be signed. And it has to be legible, and they have to know who that signature belongs to. So you may have to write out the medical provider name below that to make it clear who that is, um, or they may need to, because oftentimes medical signatures are not that legible. Okay, um, and anything that's coming from a doctor's office or a pharmacy or some location that provided some medical care or an immunization or something to you needs to have a full address on all the forms that would be signed. So, you know, just make sure that that is on there. Now, they may give you a form that they've signed, or that you may take one of our forms and they don't fill it in properly. So you do have to have a full address. It's fine. Some offices that you go to will actually have a stamp that they can just stamp the address on it and you're done. So however you want to do that is fine, but it has to be on there. That validates that that really did come from their office. And then you'll find that in several instances related to forms, the Department of Nursing has their own form. And, like a good example is influenza vaccine. Many of you may go to a medical provider and just get a vaccine. You might go to your employer and just get a vaccine. They give you something, or they send you something in your patient portal, and it just lists the dates you had it and that you're covered. But unfortunately, the Department of Nursing has to report several different components about a flu vaccination that someone has had. And you all know this if you practice and you're giving vaccines in the hospital. You have to put the lot number, the expiration date, all that wonderful stuff. We have to do that too. So when you go to get a flu vaccine, you need to take the influenza form that's the Department of Nursing with you and have them physically complete that form, because it's just because we have to have that same data that you're accustomed to filling in yourself. I would encourage you, as soon as you get access to the As You Learn project site in August, you will need to print out all the medical forms in there that you might need. Non-medical forms, you probably don't need to print out right away, because many of those have been converted to electronic signature forms in Complio. So it's the same form. It's just you go into that section where somebody would normally upload something, and instead of uploading something, it asks you to do a signature there. So again, only print out the medical forms, and you do need to get your hands on those fairly quickly, because you've got to get ready to go to do some doctor's appointments and different things. But the rest of them, I wouldn't worry about right away. These are several of the steps to compliance for our program. You have to have physical exam and safety technical standards evaluation, a criminal background check, and a drug screen, mandatory immunizations records, RN licensure and BLS certification, and mandatory education. And we'll just run through these kind of quickly. I'll leave this PowerPoint with you as an option to look back through later. So if I don't cover something, you can easily read back through it. So one of the key things that you can be doing right away for physical exam and safety technical standards is that you're going to need these two forms. So you can get access to those through the As You Learn project site. But more importantly, you know now that you're going to have to go to a medical provider to get a physical exam done in late August and before probably mid-October so that you're done in time to meet that November 1 deadline. So go ahead and be making you an appointment in that time frame now that works with your schedule as best you can and get that done. Then at the end of August, you can go ahead and print out your forms that are needed. Your standards and technical safety form is something that you actually complete. You go in and kind of evaluate your capability in several different categories of, capability in terms of physical, mental, different ways, to whether you can meet the requirements of our program. And so go ahead and get that as soon as you get that printed and fill out your part. And then when you go to the doctor, you're taking the physical exam form with you. You're taking this safety and technical standards form with you. And then when they do your physical exam, they fill that out and they sign it. You hand them the safety and technical standards document. They just look at kind of what you already assessed, and they either make a comment or review it and sign it, and you're done with that. So that just kind of helps the flow. The other thing is the physical exam requires an eye exam. So as you're making your appointment with your provider, make sure that there's somebody who can do an eye exam at the same time as they're doing a full physical. If they say they don't do that, because some of them don't do that in their office, then that may mean that you need to reach out to whoever you get your typical eye exams done, or find a place that you can get an eye exam done and schedule that now in advance as well. So those are just a few things to be thinking about how to work on. The criminal background check, you won't need to do anything with that just yet. Once you're in the project site and you can get to the instructions guide and the link for setting up Complio, as part of the ordering process of your account for Complio, you're going to be ordering the background check. There's anything else you need to do with that. It does the background check for you. You're not required to go off and get fingerprints or anything like that. All it is done electronically through Complio, running that actual background check. And then once it's done, it usually takes about a week. It will populate in your Complio as completed with any details that it located. And so that's it. Not a big thing to do. It's just part of what you order and it gets done. What I will mention is, should something come back that's concerning on it from a program standpoint, or some past history of something that would come up on a background check, those kind of things, we would set up an appointment to kind of discuss some findings with you if there was anything that needed to be addressed on there. Also, if you should have any criminal offenses or anything that occurs during our program, those have to be reported to my office within 24 hours. And occasionally you might need additional criminal background checks, but that's not real common. But should that become a need, I would certainly let you know that, that was something that was going to be required to go to a specific agency you might be thinking of going to do something at. Our program does require a 12-panel urine drug screen. And again, this is not something that you go get at all. You don't be thinking you've got to do that. You cannot use drug screens from another agency at all. It has to be done at the beginning of your program of education with us. It is also ordered as part of your package in Complio, and it's very clear in the instructions guide, step by step, how you order that. Complio contracts with LabCorp or Quest Labs, so while you're doing the ordering process for this, as you're setting up your account, it's going to ask you to input your zip code, or the one that's closest to where you're going to be during school, and then it will show you a LabCorp or a Quest that's the closest ones, and sometimes it's more than one in your area. And then as part of the ordering process, you're going to pick the one that you want to assign your drug screen to, and that will be the one that you go to. Just remember that that drug screen is time limited. I think it's about a 60-day window. So as soon as you get that thing ordered, you want to hurry up and go ahead and get your appointment and go ahead and get that done. Follow all the instructions in there about what you need to do prior to the test. They're very clear. You do want to make sure that you take that registration number that comes out as part of the ordering process, and you do have to take a valid photo ID with you to that appointment. So, that way it ties, yes, I ordered this through Complio, here's the registration number, it's already been paid for, and here's a valid photo ID showing I am the person that ordered this. And that just makes sure the chain of custody is done correctly. Drug screens are not routinely ordered again in our program unless there is a few other reasons. And the Department of Nursing maintains a no tolerance policy related to substance abuse. So the main things is if there's reasonable suspicion, just cause, there's an emergency that has occurred, there's an accident that's occurred, and you can be required to get a new one if you went out of our program, say for a couple semesters, and then came back in. You would have to have a new one at that point in time as well. Should anything come back on your drug screen that is, questionable, usually the lab itself is going to ask for more information on prescriptions that you might be on, but make sure that you're sending that to them in a very timely manner as instructed, because that could slow up the review process and for your results to be validated by the deadlines. Other things to kind of be aware of: tuberculosis testing is something that sometimes people want to do in the interim, and it's fine. If you or your employer has not required you to have a PPD within the last 365 days, then you have to have a two-step MAN2 PPD skin test. And so that means you have to go get one PPD, and then you have to wait precisely 7 to 21 days, no earlier and no later, to get a second one done. And then each time that you get it done, you have to show back up between 24 and 72 hours to get it read. So that can be a little bit of timing and coordination to get that two-step done if that applies to you. So many people who are just going to be in the program for a year will opt to it's a little more costly, but it's less time consuming just to go get a blood test done. And you can get the IGRA blood test for T-spot or quantiferin gold testing. And if that comes back negative for tuberculosis, then you're good for a year. Should you be in our program for longer than the year, you go part-time or something, then when the annual comes due, you would either need to get, the blood test again, or if you did get a two-step, the secondary year and thereafter can be a single-step PPD, as long as it hasn't been more than 365 days. So if you're needing any of that, I would encourage you to kind of be thinking about how to go ahead and get your TB testing out of the way. These are just a list of immunizations, and you'll have some of this on the check sheet that we're going to provide to you too, just for clarification, along with this PowerPoint being available. Do not worry about the influenza vaccine. We don't really need the influenza vaccine from last fall, but you will have to put your influenza vaccine in our system between October 1st and October 31st. And they do not like those uploaded earlier. So just know that will be something we'll work on in October, okay? A little bit closer down to when you get started. Some of you may have had a hepatitis B, and I just want to point out one thing about this immunization. Lots of people have had hepatitis B and had the 3 vaccines, but many places, many employers do not require you to then get a titer following that. So for our program, if you've had the 3 vaccinations and you haven't had a titer, you need to go get a titer. And that titer may show that you might not be immune. If you're not immune, then you don't meet the criteria for this. You could have had the 3 vaccines, but you have to have a positive for immunity titer result. So if you can't meet both of those criteria for some reason, in the forms section, there is a hepatitis B declination form. And instead of, some people may want to go ahead and get additional vaccinations to try to get immune. That's perfectly fine. And you can see that in the Complio system if you'd like to do that. But the quickest thing while you're doing that to be compliant in the interim is go ahead and put in a declination form for now. And then later on, if you do end up getting revaccinated and get a positive titer, then you can upload that later on. Also to note, immunizations have to stay current while you're enrolled in the program. So like if you have a booster that comes up that's due next March, then you would need to get that done next March. I also want to mention that there are a couple of categories in Complio that are optional, and COVID-19 vaccination is an optional category. Some students may like to keep their records all together so they can put their COVID-19 vaccines in there and upload those if they would like, but it's not required for our program. At this point, we have made sure that category's in there because you don't ever know when agencies may start requiring that or could start requiring that. So we wanted to have that as an option while people are getting vaccinated to put that in there should anything change with that. But again, that's not something we're going to be auditing or doing much with. There's usually also a fit testing area in Complio that is not required. It's just optional. And that's because some of our pre-licensure students may be getting fit tested to go into lots of heavy clinicals. So you'll see that, but you don't have to address anything in that category. Again, we've already mentioned about RN licensure and BLS. You have to maintain your licensure throughout the program. Should you have a problem with your licensure or change states or, it come up for renewal midway through this year you're in school, you would need to do a new license verification and re-upload that when that time came. Or if you change states, do one where you upload the correct one for the state that you're going to be in. If you have any problems with your license or something comes up with the state, like a disciplinary action or you're under investigation for something, you need to notify my office within 48 hours of being informed of that yourself, because that's something we need to know about. This is just a link to the BLS site for American Heart, the catalog to kind of look for courses, and that's available to you if you need that. In terms of required annual education, like I mentioned in the project site, you're going to see the 3 primary areas for education, and you can address those there. I'm going to have you a link to the, go ahead and provide you the link to the core orientation. Although it's in that site, it is something you could get done now if you're wanting to go ahead and get it done early. But that right now is the main ones. If we have something extra during the year that you're in our program that comes out that's newly made mandatory, then we would add that to the class site and make you aware of that and send out an email to notify you to get in there and get it done. This is the link to the core orientation requirement. Remember to print out the completion certificate to upload. And it's not going to print out with your banner ID. So I have seen some people type in their name and banner ID in the row that asks for the name on this thing just to save steps. The same thing is going to be true for the HIPAA and the bloodborne pathogens training that's in the project site. But it kind of will set you up to kind of print it, and it gives you instructions to remind you about that. For any of these tests that require, so when you're doing the little exams in there, you have to make 80% or higher, and it is set up like if you need to do a retake, you can take it more than once to get to the 80% if you need it. So as a reminder, things you got to be ready to upload. You have to meet these sort of requirements in Complio. Full student name, your banner ID, the medical office name and phone and address, has to be legible, has to be, the provider name has to be legible, and they do prefer that it's scanned over doing screenshots, because screenshots don't always come up in some systems looking like they do the way you screenshotted it. And so just to make sure the quality of what they're viewing is going to be easily read and, approved and moved on, better to scan versus screenshot. So this is just a little bit of detail about Complio. Once you upload it, it's going to be listed as pending review. And once they review things, they try to do them in about 2 to 3 days. Just know that I don't get an alert. I don't even know that something's been rejected on your account unless I'm going in there to run an audit. So the goal is you are really responsible for keeping track of what you have due. If you are noticing you put in something and it's been a week and nobody has, accepted it or done anything with it, then you need to call Complio support to check on the status and kind of push them a little bit. And if you really have a deadline approaching for something that's got to be accepted, like it's almost November 1st and nobody's doing anything with it from Complio's standpoint, feel free to reach out to me and I'll go in and check your account and see if there's anything I can accept for them. And last of all, if Complio rejects something that you've uploaded, you're going to get a message back that tells you why. So you can have an opportunity to correct it before you re-upload it. And if you're not sure, you can always contact them again to find out for more details. In terms of uniforms, we do have a set vendor. You all will not be required to have all of our yellow uniforms and things typically to go into an agency that you might do an activity in, and particularly those that you work in yourself. However, many of those agencies, even though you work there as an employee, they do want you identified as a student and not as an employee the day that you're doing some kind of activity like that. So, it just depends on the agencies that you might go into to do something. But if you want or need a lab coat with the ASU logo on it while you're in clinicals, this is our vendor, so you could certainly reach out and order by phone something if you would like. And lastly, this is just a list of names of folks that are kind of like the key people throughout our whole program. We also employ adjunct instructors that may teach some in our RN-BSN course, so you may have some additional names and people to get to know. But we want to take an opportunity to really welcome you and make you aware of who you may need to contact with specific concerns or questions. Thank you for your time today.